Welcome back. Now, the Health Department is warning of a spike in COVID-19 cases in 4 provinces. Experts say the increase is as a result of less severe Omicron subvariants. In Gauteng, the number is climbing. For more on this, we are joined by Dr Harsha Somaroo. She's a public health medicine specialist at the Wits University. Doc, thank you so much for your time here on all angles. Firstly, of course, we're seeing this increase in numbers, particularly here in Gauteng. According to your research, is there any reason why, despite the fact that the province is has more people than any other province and is a smaller one, what could be the reason that we're seeing the numbers soar, particularly here?
Okay, so I think since 2020, there has been a higher number of testing done in Gauteng province. So we have routinely detected more cases compared to the other provinces. And like you said, we do have a higher population compared to other provinces. So we would expect more cases. In terms of the recent increase in the number of COVID-19 cases, I think one thing we think might be associated with it is the recent school holidays at the beginning of October. I think usually the COVID cases, when we consider the incubation time of the virus, it increases about 5 to 10 days after transmission occurs. So that's when we start seeing the increase in the numbers. So we think that during the school holidays, there might have been more interactions, there might have been more public gatherings and more close contacts among people, which could have been a risk factor for this. However, I think as much as we are slightly concerned by the increase, numbers are low-level increases, and we'll continue to monitor it. We're really looking forward to the last week's data that will be released by the NICD today to actually see whether this trend was sustained in the last week or it has decreased. But so those are that's our assumptions in terms of what we think could be driving the new increase. You also mentioned the new variants that have been circulating. I think we've all learned over time that one of the risk factors for increase in transmission is a new variant. However, I think in terms of the variants that we're seeing in Gauteng, these variants have been seen consistently for a few weeks now. I think in terms of the new subvariants of Omicron, we've actually detected these at low levels since about July, and the numbers were slightly increased and then slightly decreased. In the last week, where we saw the higher number of new COVID cases, the subvariant that was detected were actually the Omicron subvariant BA.5 and 0.2. So I think in terms of that, we need to continue doing what we're doing with the surveillance and tracking the subvariants, tracking the wastewater surveillance, and also we're paying a close attention to the hospitalizations. And it's a bit of a relief that in the last week, the hospitalizations did decrease compared to the previous week. And there has been a low number of COVID deaths reported as well. So we're hoping that that picture is sustained.
Yeah. Okay, so that's good news to hear, Doc, because at least it means that we're not seeing too many deaths. But what does this mean then? Because obviously the country would detect with the number of infections in Gauteng particularly, and then KZN would normally follow to see if we're going into another phase of insurgency or insurgents in terms of COVID-19. Is this the trend we're seeing now? Are we going into another one of those periods?
Yeah, I think it's too early to predict that. We do need to monitor the case numbers for, especially today would be quite interesting. And then for the next few weeks, hopefully we're not going to see a resurgence in the numbers. But I think what we need to remember, I think we've learned a lot about COVID-19 in the past 2.5 years. And it's similar to the flu. The virus is transmitted quite easily, but I think we know what we can do to protect ourselves, especially if you're vulnerable. We know that people who have higher risk factors for severe disease are people over the age of 50 and people with comorbid illnesses. And so I think they need to take extra precautions, especially if they're going to be in crowded spaces where the risk would be unknown. They also need to make sure that their vaccine schedule is updated, because this is what will protect them against severe illness and, most importantly, death.
Now, tell me, in terms of vaccinating, right, something that is supposed to at least prevent us from severe illness or death, is this something that we should still be preaching? Because I haven't heard government in a long time giving statistics on who has, received the jab. At some point, we were supposed to go for the third one. If obviously you took Pfizer, you were supposed to go for a third one. But by now, I believe that probably your protection is a bit less by now.
Yeah, so it's a bit of a mixed bag. We have this hybrid immunity from the vaccination, also from the protection from previous COVID infection that does wane over time, which is why the booster is recommended. But at this point, it's only recommended for people who are at risk for severe illness. So I think that would be people over 50 years of age who have been targeted by the current government rollout. But if people have comorbid illnesses as well, it would be recommended that they do receive the booster. The non-pharmaceutical interventions have really received less press since the vaccines became available. But that is really the easiest way to protect yourself. The virus cannot be transmitted if you're not in contact with it. And so I would recommend that anybody who feels that they would be at risk of contracting the virus wear a mask when they are in public spaces and in crowded gatherings. I still wear a mask if I'm in a public space and it's crowded. I keep a mask in my bag all the time. I think it's an individual decision that we have to make to protect ourselves.
So it's definitely still going to be a new norm for us for quite a while, yes. COVID-19. We're definitely not completely out of the woods, even though life feels a little bit more normal than it was or than it became back in 2020. Thank you so much for speaking to us.